Welcome to today's episode, brought to you by the Women in Medicine Summit, a transformational CME conference happening September 13th to 14th at the Drake Hotel in Chicago. Engage in leadership programming, learn negotiation skills, receive on-site coaching and mentoring, and see who will win this year's I Stand With Her awards. This year, we're excited to offer unique programming that includes a special session on how using improv comedy can bring fun back into medicine. We also have financial sessions tailored to help you navigate the complexities of personal and professional finances. Discover ways to advance into leadership roles, combat burnout, and either reignite your love for your current role or find joy in a new career path. Don't forget our Friday evening gala, a highlight this year you definitely won't want to miss. Register now at womeninmedicinesummit.org and be part of the movement that is shaping the future of healthcare. Join us to network, learn, and celebrate the power of women in medicine.
Welcome to the Revitalizing Doctor podcast. We explore with our guests how you can move from surviving to thriving as a physician. We know that when you connect with your values and authenticity, you can live a life that is fulfilling and not only good for you, but drives the necessary transformation in healthcare to take better care of our physicians, which means better care for our patients. Hi, the next big thing happening at Revitalize is our upcoming mini mastermind course that is Boundaries, the Key to Beating Burnout. That will start on June 8th. All the sessions are virtual and will meet every Wednesday for 4 weeks at 4 p.m. Pacific and 7 p.m. Eastern Time. This is going to be an awesome course. If you, like many women physicians, feel like you are on a treadmill, that you don't control the incline, the speed, or the destination, we are going to help you develop the tools to more clearly communicate your boundaries, ensure your boundaries are linked to your values, and develop an accountability and group of people that can support you in maintaining your boundaries well beyond this course. So we're really excited to help you live a better life, both at home and work. And if you'd like to learn more about this course, please give us an email at revitalizmm.info@gmail.com. You can also check out our website at www.peoplealwayshcc.com/boundaries-1, and you'll be able to also download a free boundaries worksheet on our website to get a taste of what we'll be covering in the course. It is my pleasure today to have Dr. Katrina Landa on the podcast. Kat and I know each other from our time in the military together, and she has done amazing work as an emergency physician and as a military physician. So I'm going to let Kat introduce herself and tell us more about her story. So Kat, tell us a little bit about who you are, where you grew up, and how you became a military and emergency medicine physician.
Thanks so much for having me, Andrea. I'm excited to be here. So like you introduced me, I am Kat Landa. I am an emergency physician, currently in the United States Navy. I almost feel like I need to have a little disclaimer out there about being in the Navy. And again, this is my own personal opinion and what I think and feel, and doesn't reflect anything on my military service as, professional military doctor. But yes, I grew up in upstate New York, kind of all over the place. My dad was a healthcare CEO. So we moved every few years, and as he took up bigger hospitals. And I got into medicine after volunteering at one of his nursing homes as a kid from age 9. And I adored dementia patients and just kind of got a real interest in medicine from that specifically. And I basically worked in geriatrics from the time I was 9 years old. And that's how I decided I wanted to be a doctor. As for emergency medicine, that's more of a winded road. I wasn't a gunner med student at all. I had a lot of fun in medical school, and I really embraced kind of who I was and decided I was going to have a well-balanced life, even as a med student. So I pursued working out much more than I do now. And I had lots of friends and went out and did things. And my grades weren't phenomenal, but I did fine on my boards. So that was good enough. You know, a lot of my classmates who were gunners were very much into emergency medicine. And it almost turned me off to it, which is a funny thing in retrospect because now I work with these people. I actually started my career in family medicine and quickly learned that is not for me. And I actually truly did love ER. As for the military, my dad actually had suggested it to me as a way to originally fund medical school. I was fortunate to have my undergrad taken care of, and the only other doctors in my family all did an HPSP. I'm not sure if it was the same program at that time, but my uncle did it back in the 70s, and then his son did the same program. They were both Air Force. And I chose the Navy because they had better duty stations. And at the time, they did not wear combat boots or have utilities. Now, I had no idea that the Marines were served by the Navy. Before I came onto active duty, quickly learned that we were going to utilities. So that was a big transition for me.
Well, tell us what HPSP is, because we may have some medical students that are thinking about, could the military be a good option for me?
That's a great question. Yeah. So HPSP is the Health Professions Scholarship Program, and it's one of several avenues that the military grants to people pursuing professional careers, particularly in medicine, but they have the same program for dental students and for some other professional medical degrees. But for medical school specifically, it's basically a scholarship program where the military pays your tuition, and if you are good with filing paperwork, we'll reimburse you for your books. I did not take that path, unfortunately, as a misguided 20-something-year-old. And then basically you owe them the same amount of years that you were in medical school or your residency time, whichever's longer. So 4 years of medical school meant 4 years of payback, not including your residency time. So it's actually a pretty good program. I've served back my time already and decided for whatever reason to continue on in my career with military.
Yeah, so let's dig into that a little bit. So you did a family medicine internship, and then what happened?
So I started family medicine, and in fact, actually, I have to back this up just a tiny bit because I was accepted to family medicine while I was doing my first rotation of emergency medicine as a fourth-year medical school. And the day I matched in the military match, which is in December, vice in March, where all the civilian matches are, I was actually told by two different emergency physicians at the children's ER I was working at the time, like, why are you not applying to ER? I was like, I actually just matched it to family medicine in the military. And they were like, oh no. And so I kind of already got that seed planted, as in like, I actually really do like this. And for the first time in medical school, as strange as it sounds, other than in family medicine, I felt like I actually belonged. I really much felt like an imposter in most other specialties as a med student, especially. And I'm not sure exactly why. I think we all go through imposter syndrome. I mean, I still deal with imposter syndrome. I think many women especially do that are in this profession. Yes, it was where I felt comfortable and at home, and that I had the mind for this particular specialty. Whereas, something where in internal medicine, they want me to recite 15,000 causes of hyponatremia when I already know why they're hyponatremic, or why do we care so much when we already are fixing X, Y, and Z. Not to say that they're not important things. But yes, so I matched into family medicine. And as soon as I started my very first rotation, July of 2011, it was OB-GYN. And I hated it. It was the worst. That was a quick turnaround for that. And then also clinic. And then I got on my ER rotation as an intern. And lo and behold, once again, the physicians there were military physicians because I was at Camp Pendleton. And they were like, Kat, why aren't you going into ER? You're doing a GMO tour, right? This gives you a great time to actually apply. We really recommend it. There, you can do X, Y, and Z. So they really mentored me, even as an intern who was not one of them at the time. So I'm fortunate for that.
So you do your FP intern year, and then you go out and do what's called a General Medical Officer Tour, which for most of our audience that are civilians, they don't know what that is. So you had a break in training, very normal break in training for people in the Navy. So what did you do after internship?
I was sent out as a general medical officer. So my intern year was spent on a Marine Corps base. And I actually found, even though I knew zero Marines at the time, from friendships from before my military time, and I didn't really know much about the military at all, I found that I really liked taking care of these patients. They were entertaining. It was kind of foreign. There was a very odd hierarchy, and it intrigued me more than anything else. And they also are very funny ER patients, I think, for the most part. Yes, so I went out as a GMO, and that in itself was even kind of chaotic because it's a match process. In the military, when we do our matches, you basically have a detailer telling you, hey, you're going here. And so I ended up actually with the Marines in 29 Palms, which is kind of a rough and tumble area, as the first female battalion physician. So a physician for 1,000 Marines in a previously all male battalion. And that was it was actually an exception to policy that Congress had passed in 2012. And I found out I was going there the day after it passed in 2012. And the detailer said, and I was trying to stay in California because my husband was just about to start dental school. He was like, I'm sending you to 29 Palms. Don't ask me for any more favors at all. Click. And so I'm like, okay. So I'm asking around, like, what does this mean? What is this life going to be like? And every male colleague of mine, senior to me, that had done a GMO tour with Division, which is the ground combat Marines, was like, you're doing what? They're sending you where? Why? And no one could understand it. And I was actually starting to get entertained by this. This was a very odd thing. I was very anxious about it because I had no idea what I was getting myself into. And the more that people actually told me about it or gave me their thoughts and feelings about women going to ground combat, I became more and more like, this is going to be a strange transition. I don't know. Are they going to expect me to run 15 miles? Am I going to be expected to be a Marine? That's not me. I didn't join the Marine Corps. So it was an interesting transition. So during those 2 years, I went out to 29 Palms, which is the high desert, Mojave Desert in California. And I worked with the Marines every day. I did their primary care, a lot of teaching for corpsmen, which are the medics of the Navy and the Marine Corps. A lot of leadership roles. I didn't realize that more than 50% of my time was going to be spent in meetings and operational planning with the Marine Corps and just the amount of paperwork involved. I was also lucky to just fall into an urgent care job, which in retrospect, as an internship only trained doctor working at an urgent care in the middle of nowhere prior to the Affordable Care Act. So I had lots of patients coming to the urgent care because they couldn't afford to go to the ER. That's terrifying. I'm like, oh my goodness, I can't believe. But fortunately, I did send quite a few patients to the ER or AMA'd them because they wouldn't go. Yeah, so that was my 2 years there.
Wow, it's such a crazy story. So in 2012, I'm just still trying to wrap my brain around it because it's not that long ago, you were essentially integrating the Marine Corps infantry.
Yes. Well, yes, for the ground combat. I was with artillery, so they didn't actually work with the infantry until several years later. And I was actually able to mentor that female physician that went with the 1st Infantry battalion. But I was with artillery, which they put me with because as a whole battalion, they hadn't deployed together since 2009. And so the likelihood of them doing that during that time in history and the operations, the counterinsurgency operations we were doing in the Middle East at the time, artillery wasn't necessary or required. It's more of a conventional warfare, things that you think about with like World War II or, Korea, those types of things. So yes, I was the first person to go with it. And that's why they sent me there. It was me and it was 2 female Marines with over 900 men.
So how did they receive you? What was it like?
It was almost surreal in a way. So at the time I had like platinum blonde hair. I mean, it's still pretty light, but platinum, perfectly cut. I put on a lot more makeup than I even wear now. And I was fortunate to be sent, even though looking back, I'm like, this is a good program, but oh my goodness, it was hard. The same one that Danielle just did, to a field medical service training school, we call it in the military. It's really a 2-week course where you have Marines training junior internship doctors, because I was in the summer program, that's basically all it was, on the Marine Corps and how to wear their uniforms and what their customs and courtesies are, how to shoot a weapon and how to put on all the gear and what you're supposed to do, what you're not supposed to do. And it was overwhelming. I was very lucky. One of my co-interns was a prior Marine, and he was wanting to go back to his former battalion. He was a former infantry officer. And so he had actually taken a break as well and gone out as a GMO. He had chosen to. And he was so helpful. My friend Bob really helped me through that whole process and was incredibly patient and supportive of me actually doing this job. He recognized more than I did at the time, how big of a transition this was. And he really set me up for success. Bob really, I hope he's doing well wherever he is now, because in my heart, he's still always a hero because of this. I mean, just even getting the uniform on right and what you're supposed to do. And certainly my military bearing was not there. And that's, we think of marching and stuff like that. Everyone always thinks you do that in the military, which I don't think I've marched much in my entire life. But all these little things, the little cues, the social cues, he kind of gave me a very quick course within this larger course on how to do that well. And I found that doing some of the craziness, like gas chamber, right? You're putting on a gas mask after running up and down hills and carrying litters, which are, basically those, the Talon litters, right? Where you're carrying a fake patient, a simulated patient, 200 pounds, all this equipment. You've got your gas mask on, going up and down hills. Then you're going into a gas chamber. And while I was doing it, I was like, what? This is so foreign. This is an odd place to be. What? I would never imagine myself doing this. And in retrospect, I've said that so many times in my career now that I think this is probably what keeps me in. I'm like, well, what new entertaining thing am I going to do now? It's I should just write a children's book series, right? Of this is what I did. And oh my goodness, as a cartoon, I think it'd be a good cartoon. So that was kind of the transition. To go back to your question though, Andrea, how did they receive me?
Yeah. So, did they experience some bias, or were they, we'll have a picture of Kat to go with this episode, but she looks like a Dr. Barbie. I mean that in the nicest way possible, but she has beautiful blonde hair. She has a vivacious personality. And let's face it. Marines for the most part embrace a very alpha male personality, and somebody like Kat or me, I will say I'm red hair Dr. Barbie. We don't look like we belong. I'm just wondering what your experience was with that. Stay tuned. We'll be right back. Are you a physician mom with school-aged children feeling utterly exhausted? My friend Dr. Sheeta Shaffi invites you to take a little time this summer to join her in a small, intimate group for meaningful conversations. Dr. Shaffi is an emergency physician, coach, and mom to 8-year-old twins. She understands firsthand what you're going through. This isn't a pizza party or a yoga class. You'll meet for 2 one-hour sessions twice a month starting in July to help you move out of exhaustion, let go of mom guilt, and live a life you're not only proud of, but can truly enjoy. Connect with her on LinkedIn or Instagram at Sheeta Shaffi to learn more. Sheeta is spelled Shideh, and Shaffi is spelled Shafie. You can also check the show notes for a link so you can connect with her there as well.
So when you go to a new, especially Marine Corps or operational position, regardless whether you're a doctor or a line officer, you meet with the commanding officer. So this is a man who had been in the Marine Corps, deployed a million times, but he'd been in for, I think, 15 years at the time. I think he took this as a particular challenge. So this is a family man. He has 5 kids. And his oldest was a girl, and his wife is very blonde and vivacious. I think he took this as a challenge, as in, I think she's going to need to succeed for my own career. I think that's where he came from, because he's a very smart, and I really, to this day, I admire him, because I truly think that lieutenant colonel I had at the time really did set me up for success. He was very clear in his expectations. So I walk in to meet him and he's like, okay, Kat, have a seat. Here are my expectations. We're going to do runs. You are not going to fall out of these runs. You need to keep up with us. You know, you need to make sure that you're able to go to the field. And artillery, they're field artillery. So going to the field is like bad camping. It's like survival camping, but there's no bonfires and there's no alcohol and
No s'mores.
no s'mores. And you're wearing like 40 pounds of equipment and it's also 125 degrees because you're in 29 palms in the summer, which is when I checked in. So he was like, in fact, we're going to the field next week. And little did I know, you're actually supposed to have 2 weeks to like actually acclimate when you go to the desert. That's a rule. But of course, Marines don't abide by that. And it was also a challenge to me, which in retrospect, I realized by the time I was like, oh, okay. You know, just so naive and so like, oh, okay, here I am. But yeah, he was like, we're going to the field next week and you need to go with us. He was like, anytime I'm in the field, you're going to the field. And we went every single month for the entire time he was CO. And then even after he left, that was still kind of the expectation because they supported the infantry out there with all their field exercises. So they basically threw me into it and it was quite the experience. The other piece of this that I think I have to mention, like how did the Marines in general, so that was my CO, that's from like the highest leadership. But truly, when you think of Marines, I think when the average person thinks of the Marines, they're thinking of enlisted Marines, right? The people that run around with their rifles and, you know, are on TV. And those were the kids, my patients, really. But that also, I was now part of a battalion. So a very weird place for a doctor to go because you're integrated, right? I was the only doctor there. I have no nurses. I just have corpsmen. I'm one of 3 females in the entire battalion. I'm one of 2 female officers in the entire battalion. And it's kind of an odd place to be. Long story short, the other Marine officers that were female or the other Marines that were females checked in at the same time I had. The first week that I'm actually seeing patients out of my clinic, which is in the building where all these other Marines work, I had a line out the door of Marines coming in and checking in with testicular pain. And the way that military sick call, which is kind of going by the wayside for the most part, but it used to go, is that it was basically urgent care, right? It's an open clinic. You just come in, here are the hours that were open. Whatever problem you have, you come in during that time. And then the corpsman kind of triage, okay, can this be seen later? Does this need to be seen now? And so testicular pain, as we know as emergency physicians, is a big deal. And so those will be seen that same day. So 2 days go by and I've got Marine after Marine after Marine with testicular pain. It took me 2 days to figure it out. And I pulled my first move that I had randomly learned from a senior resident that had been with the Marines and had mentioned it just in passing. So these testicular pain GU complaints, I realized they were all just coming to see the new doctor, the girl doctor, which half of them thought I was a nurse, probably more, I don't know. And so by day 2, I'm like, this is very strange. So in military medicine, a corpsman can do anything a doctor does if they allow it under their scope. So I'm going to put that out there as in like this is a common practice and it's a legal practice in the military where, you know, corpsmen can do exams for you and you could watch them or you can be there, but you don't have to do every single exam in an operational setting. And you actually need to train them because they'll go out and practice independently when they're in the field and they need to know these things. So it's part of their teaching too. So by day 3, this is still going on. There's a line out the door and I'm like, are these all testicular pain again? And again, I've been there for, a week and a half and the corpsmen are like, well, let me go find out. Yes, they're almost all testicular pain. I was like, well, give me the one that's not. And the ones that are, please let them know before I will ever see them that I'm not doing their testicular exam. And if they're coming in with testicular pain, they will be checked for prostatitis and any other GU complaint that's down there. And I'm not doing that exam either. And you can go into detail on what that is. And I told the corpsman, you could spell it out, what a rectal exam of your prostate's going to look like. And lo and behold, that line cut drastically. So the ones that actually truly had a problem continued to see me. When I told my CO that several, probably months later, had the balls to tell him that. And he was like, oh my God. And that's when I realized that my CO really actually was thinking like, I might accept this person. That was the first moment, but yes. But going to the field was probably the other big test.
I just love that story because there were clearly some people in that line that were trying to, I mean, let's just face it, that was in a way kind of trying to demean you or trying to make you look at their genitals. Highly inappropriate, whether they thought it was funny or they were doing it in kind of a mean way. And you had to think outside the box of how am I going to stop this really egregious behavior, knowing that somebody in this line could actually have a legitimate complaint. So I have to find a way to thread this needle of providing medical care, knowing that it's a bunch of men that could have a real testicular complaint, but I'm also not going to, take any shit. I think that what's the Brene Brown quote, soft heart, strong back.
Absolutely.
And I think that is this is exactly why we want to have Revitalize, because you run into these really strange situations in male dominated environments where you have to figure out a way to be firm, but also I'm wondering, and I bet you probably can think back to a time where that soft heart was probably a good thing for those Marines and probably was the first time that they had a physician that could have that full spectrum of like, I'm not taking any shit, but I'm also here to advocate for you. And maybe I can approach this problem a little differently than maybe some of the people that have filled this job before.
There continue to be ways like that. And I think as I've advanced in my career, when I've gone back to work with Marines, whether it's in the ER as a staff or an attending, or when I've deployed now with them, I think I take a lot softer an approach. So my initial approach had to be very hard. And so my first year, I never strove to be a butch Marine, right? I never wanted, my goal was not to outrun them. I mean, I'm not a runner. Like, just keeping up was enough for me. And I was like, well, if anyone else falls out, I'm going to go check them out because I am a doctor, so I probably should. And I just used that as my mentality. When it came to actually laying down the law, I'd say my first year there was hard because many of us have problems setting boundaries. I was not raised in a family where boundaries were applauded or recognized or really taught to me. I was the youngest, right? Whatever is left over, that's what you get. And so I kind of swung in the opposite direction very quickly. Like, I have to lay down the law with these people. And a lot of my bubbly personality, I learned I had to kind of tamper down that first year. And what it brought to me was actually being miserable. Like, why do I hate this so much? I mean, it's not fun. And going to the field initially wasn't fun. In retrospect, I actually ended up learning how to enjoy it. And so I do have some great memories. But yes, it kind of swung in that opposite direction initially. Whereas no, I'm going to be hard about X, Y, and Z. That being said, people that I had quite a handful that had been recently in Iraq and Afghanistan, a small group that had gone forward with one of the infantry battalions on a pretty horrible mission. I want to say it was in Sangin, Afghanistan. When they came back, it was a very small cohort. I think they had gone as provisional security or some other non-artillery mission. They clearly had post-traumatic stress and were having issues. And a lot of them, this particular group, there were several that had weight problems. And when they kind of peeled back the layers, and in the Marine Corps, that's a huge problem. They can't promote, they get ridiculed. And so to top off their post-traumatic stress, they were also really being kind of bullied and attacked at work in that way.
So essentially, when you're in the military, you have to maintain a certain weight. And so they were overweight, right?
They were over Marine Corps standards, which are very tight. In the Marine Corps specifically, there are a lot of eating disorders that we're starting to kind of uncover, publicize a little bit more that we're finding in groups like this, where how you look and your physical performance and certainly looking good in your uniform is highly prized. And especially for them, I mean, that's one of their promotion pieces.
Wow.
Yeah. So I remember one specifically, he was a sergeant And when he came to me about his weight, I peeled back the layers that he was drinking a lot. And I was like, well, I think that's probably why you're overweight. You're drinking too much beer at nighttime. And what's your diet? Oh, it's pizza and this and that. You peel back another layer and he's truly suffering. He had a TBI while he was there. He had PTSD while he was there. And this is before, we were working towards fixing these things in 2012. But we were where we're at today with the resources. And so I started working to plug him into resources. And I learned to go to bat for him, which, brought a lot of fire to me as a female doctor in military operations and leadership meetings. When I go to these meetings and I tell my commanding officer and his commanding officer, who's a lower ranking person, like, this is he's having problems. And in this situation, my commanding officer, our joint one, the highest one, does have access to some HIPAA related things. So I would go behind closed doors and say, this guy is suffering with PTSD. He's had TBIs. I've referred him to X, Y, and Z, but the way that he's being treated is not right. And did that change things for his day-to-day treatment? I don't know. I learned that there's a fine line that you walk because, again, that commanding officer I had was very good at being like, Kat, I hear you, but this is how the Marine Corps works. And so I got an education on really what the mentality was. And it truly was a study in like alpha male culture for 2 years. I was like, submerged in it. So I got that feedback, but I was able to work on the other side of things to actually get him out of the military with full benefits. And I feel like that's where I really won on that one. And I didn't really recognize it until a year later. A friend of his came to me and who's kept in touch with me actually over the years from time to time. And he said, thank you so much for taking care of my friend. I was like, I'm sorry, who are we talking about? And so he brought up, and I said, oh, yeah, of course. Like, that's my job. That's what I do. And he was like, most people don't do that. Mm-hmm. And so it was nice to kind of recognize, and I learned that there was a place to actually truly make a difference in this community. Like, there was a need that was going unmet. And I don't know why. And again, it's kind of like this very alpha male culture. And a lot of male physicians, I think, had kind of fallen into that because it's easier for them. And for me, I was already paving my own way. Why not do it the way I thought was going to be the right way to take care of patients at the end of the day?
Yeah, that's such an amazing story because we don't really know what could have happened, right? Who knows if he didn't have his back, if he would have been one of the many Marines that commit suicide.
We had one. Yeah, we had one, and he never had seen me. So had never sought help, no clue what the background was, but it's a huge piece in the military is suicide, as it is in the physician community nowadays, unfortunately. And it's a lot of the same pressures and stressors, or at least the same type of background, expectations and ideals and things that you certainly can never reach or you aspire to reach. You've told these are your goals, your ideals by the bigger society, whether it's the Marine Corps, whether it's medicine, whether it's emergency medicine, of what the ideal fill in the blank Marine doctor, ER doctor looks like. And if you can't meet those things, a lot of people they suffer. And ultimately some of them die by suicide. It's tragic.
I just love this conversation so much. I know we ended on a rather dark note about suicide and physicians and our veterans, but hang in there. We'll be back next week, and we're going to pick it up with this great interview with Dr. Katrina Landa. And I'm really excited about next week because we're going to talk about how do you navigate that line between being tough, which you absolutely need to do in this very male-dominated environment that Kat found herself in, but how do you also embrace your authenticity? And when do you turn on that compassion and slowing down and really bucking the culture that you find yourself in? These are really difficult questions, and I can't wait to talk to you more about it next week with Dr. Landa. Thanks for listening to the Revitalizing Doctor podcast. This podcast is brought to you by Revitalize Women Physician Circle, founded by Dr. Linda Lawrence and Dr. Andrea Austin, your host. You can connect with us on our website at www.peoplealwayshcc.com. facebook.com/revitalize. You can tweet at us at Revitalize Women, and please connect with us on LinkedIn at Revitalize Women Physician Circle. We look forward to helping you go from surviving to thriving. This podcast represents our opinions and the opinions of our guests. It does not represent any entity that we work for or with, including the military, the government, or any other institution. Thanks for listening, and we'll see you again soon.
Hi, it's Dr. Risa E. Lewis, dropping in to tell you about a book that Dr. Adara Landry and I wrote. It's called Microskills, Small Actions, Big Impact. It's a business self-help book coming in 2024 by HarperCollins. Pre-order now. Microskills, Small Actions, Big Impact, wherever you buy your books.